October is Breast Cancer Awareness Month, and we often hear how self-exams and regular checkups are some of the ways to help detect cancer, but there's also an option with a blood test that could help women evaluate their risks for certain cancers. Here to tell us more today, we're so pleased to have Tamara James, a doctor with the Lexington Clinic, and also Missy Mars, a cancer survivor who has experience with this type of testing. Thank you, ladies, for being with us today. Dr. James, we'll start with you. Tell us about this blood test looking at genes that could indicate a risk for cancer.
Well, 10% of the breast and ovarian cancers that are present in the United States are associated with a mutation in the gene. This gene is called the BRAC gene. You can have this blood test done at your doctor's office.
And is it something that is a first step before you have some of the more invasive screenings, or how is that usually handled with patients?
Originally, what happens is we discuss with our patient her personal history, then her family history, and we determine if she's at risk for carrying the gene. The main risk factors are either the presence of breast or ovarian cancer in her family, and then the finding of that disease at an earlier age than expected.
Missy, how did you become familiar with this test? What is your own involvement and story of this?
My grandmother died prior to me being born of ovarian cancer, and about 4 years ago, my mother also was diagnosed with ovarian cancer, and with 2 women in my family who have had ovarian cancer, I did some research on genetic testing and decided that it was probably an option for me. I had the BRAC testing and did test positive for the mutation, BRCA1. I went ahead and did a double mastectomy and reconstruction, prophylactic, and also a complete hysterectomy. And had I not had this test, I would not have found that I already had stage 1 ovarian cancer. So the test actually saved my life because I was able to find out that I had a higher predisposition for it.
Wow, that is amazing. And for patients like Missy who know they have a family history, how do you suggest they approach their doctor about having this done?
I think that they should be proactive and actually ask for the testing, especially now with this being Breast Cancer Awareness Month. The BRAC analysis has an ad on TV that makes people aware of their risks, and so when they see their physician for their annual exam, they can go over their personal history and their family history, and then we can order this blood test.
Wonderful. Well, thank you for sharing that information. Thank you, Missy. That's an incredible story of how that, as you said, saved your life by taking that test. We have more information on the BRAC testing on our website in the health section of WTVQ.com, including a link to the company's website and ways that you can talk to your doctor about getting the test yourself. Thank you so much, ladies.
Thank you.